Welcome back. You're still watching Daybreak on this 9th of April 2024. And like I told you, I have Senator Richard Onyonka from Kisii County. I have Kanyuthia Mutunga, the chairperson of the National Assembly Agriculture Committee, and shortly we'll be joined by Honorable Madenge from Nyeri Central Constituency, who is also a member of the Health Committee. And as he joins us, you will see the main stories on the Daily Nation. Musalia to fold the NC Grant UDA plan. Then also there's the patient's agony as medics take to streets. That is on the Daily Nation. On the Standard, it is tough questions as Linturi claims fertilizer is good. Agriculture CS Mythical Linturi is insisting that there is no fake fertilizer in the country, only saying that the questions are only on some 3,000 bags which were found unsuitable for use. We'll be obviously listening to what they have to say. But also there's another story on the Standard about school layoffs loom in secondary schools. And there's a question of a review of some of the books that are being used to give instructions in the CBC implementation. And they're saying by January 2025, there will be new books for the term. So publishers have submitted manuscripts for books that will be used from January 2025. It is a story that you find on the back page of the Daily Nation. And then the one textbook per learning area or subject was based on the cheapest rather than the best in content quality. That's according to the Presidential Working Party on Education Reforms. So Honorable Madenge now joins us. Good morning.
Good morning, Sam.
Great. And Senator, good morning.
Morning, Sammy, morning.
And Chairman, how are you?
Very fine, Sam. How are you?
I'm all right. It's good to see you here. I want us to begin by reflecting on the health crisis that appears not to go away, knowing that it's now 27 days since the start of this, and we continue to speak about it, but it appears that there is no end in sight. I don't know what your thoughts are this morning, Senator Onyonka, especially knowing that the most affected facilities are those that are managed by counties. We hear the governor of Nyeri telling doctors either you come back or you're not getting a salary for the month.
Well, naturally, Sammy, when normally there are issues like the strike that you have, which is affecting the doctors, there's a likelihood that people will be shooting from all angles, trying to blame everybody else. The truth is the doctors had a CBA, which was signed in 2018. This CBA is supposed to be implemented. I have seen the president say that we cannot afford to pay doctors any more money. For me, it doesn't make sense. The logic and the reason is that, number one, the CBA was registered, it is there, it was supposed to have been signed, to be implemented 2 years ago. The argument that I've seen, which has been brought forth, is that our doctors are actually nearly earning the best within the region. But when the arguments are coming out that our doctors are earning better than anybody else in the region, you don't look at issues like cost of living, that's inflation, and all the other outstanding issues. Number two, our weakest link on this issue is actually at the county governments. Mm-hmm. I can tell you that if you go to Kisii County, the issues that doctors have been having, the letters that they've been writing to my office and to the Senate, is that the health sector has a problem. In fact, even when there was no strike, some of the governors were not paying the doctors. Some of the governors have been behaving badly. They transferred doctors from one department to the other. Some of them have politicized the health sector. You find that a governor is elected, he comes on board, he starts running the county from 2 years ago. And you find doctors have been transferred from one section to the other. Their training doesn't matter. Some of our health facilities, especially the primary healthcare facilities from level 1, 2, 3 up to 4, you'll find they don't have medicines. The health sector in general has a problem. Right. But my hope and my wish is that I think the president needs to rethink. I was happy to hear him say that, according to him, this is a matter that we need to discuss. My sincere feeling and the general feeling, even when you talk to my colleague senators, they're saying, if you look at the way we behave, Sami, if you look at the way we are spending our recurrent expenditure on things that don't matter. I mean, you've seen from Friday, the story is coming out how governors are having motorcades, people are buying chairs costing 500,000. Many of our governors have never even realized that if you go back historically, you'll see that doctors actually used to stay around the medical facilities. The medical doctors' housing units are in a mess. Their allowances are hardly paid. Some of them need to go for training. So for me, I think that how I wish that the government could look at this thing comprehensively. And then we run through what are really the issues that are affecting the health facilities. What is the government policy? Have these health facilities within the county governments followed the government policy? The success for me for the KK government is that community health workers have been implemented. They have started their work. Of course, they are earning minimally, but at least you can see that they have started moving in the right direction. But we must look at our doctors differently from the way we are looking at them. And our position in the opposition is that let the government pay the doctors. The doctors are asking for 200,000. We are saying if the government can give even them, if we can give them 100,000 for them to keep moving and helping our people, so be it. So I would like to say that I think we need to stop handling this matter as if it's a trivial matter. Doctors are now going to be at home for a month. If they go to the second month, the health sector is going to collapse. So it's something that I think the government needs to look at seriously. And I think the minister needs to engage herself very seriously and walk away from the normal politics that we do. You know, in Kenya, politics is everything. Doctors, ministers engage in politics. Everybody engages in politics. How I wish that the minister would literally sit, look for teams, engage the doctors very, very seriously and see whether we can get a way forward.
So, Honorable Mutunga, at the moment there has been talks going on, but then the industry action continues. As we speak, the Kenya Union of Clinical Officers are also on strike. They have been away for a week now. If you are talking about the medical lab officers, they're also at home almost a week now. Meaning, if you go to a hospital, you only find a nurse. You cannot get any further action beyond that. Your diagnosis cannot be thorough because the medical laboratory officers are not present. Yet, the only statements that are coming from the government is, we have no money, just go back to work. I mean, how do you make that work?
Thank you, Sam. The government has an agreement with the doctors. The collective bargaining agreement that was done in 2018 contextualizes the provisions that were agreed upon and also the framework for implementation. And I'm sure the reason why doctors are on strike is because they feel like the government has not been keen to implement the collective bargaining agreement. Having nurses alone in the hospital, you know, the definition of a nurse is somebody who can only assist, somebody who can take care of a situation whose status has been determined by someone else. And we believe they may not be able to effectively treat serious cases, and we are leading to a situation where we believe we can easily paralyze the medical services. Having said that, I think there should be room for the negotiation. That's what I think, because budget must be planned for, money must be voted in the budget for us to be able to pay. If everybody decides to have their collective bargaining agreement, the teachers come up, the doctors come up, and others come up, we can easily collapse the service provision of our nation, of our country. So I believe this administration is looking at this matter seriously. What needs to happen is that we need to detail the whole issue from the service promotion centers. The situation under which the doctors work, the level of resource supply sometimes is wanting in most of the hospitals, in most of the health centers and dispensaries. And we need to start from the service, the health facilities, the service provision itself. Look at the entire continuum. Look at the situation of the doctors as it were, as people work many hours trying to save life and to prevent pandemics and epidemics. So having said that, looking on the side of the government, I would like to imagine that the ministry should be keen to have an amicable solution between the doctors and especially the county governments. And I don't think issuing very stern pronouncements like what you've seen in Nyeri is helping a lot. What should help is getting to a round table and discussing how we can deal with this problem in view of the fact that probably money was not voted for this particular implementation. And my opinion is that we need to talk to the doctors, we need to renegotiate the terms, we need probably to look at the framework under which we can deliver what they are asking for.
Okay.
And even if we are comparing them with the region, I would imagine that Kenya is a different economy. And we may not be correctly...
But when you listen to the president saying that the wage bill is now at 47%, we cannot continue to increase the wage bill, we have to sacrifice. What does that do to the striking officers?
What the president is speaking about is the entire wage bill. There is that intention to try and bring the wage bill down to 30% of the budget. Ideally, the wage bill should be around 25% of the budget. The personal emoluments and so on should be lower than the money for development. If we have to develop an economy, we must put more money into the development projects than personal emoluments. And you see some initiatives that have worked very well are those that are lean when it comes to the personal emoluments. And even if you look at the arrangement, the agreements with most of the donor countries, when it comes to programmatic arrangements, the negotiation point, the most hotly negotiated point, is the point at which we ask ourselves how much of the money that is being released by the donors, whether it's a grant or it's a loan, that will go to personal emoluments as compared to what will go to development, because the most important thing is development. But on the other hand, when you look at it, is that the volumes also matter. If we have very little money at the end of the day, and we have huge bills because we have so many people already engaged and you cannot lay them off, then you may not transit to such an arrangement in an overnight. You must structure this slowly in a way that it can be able to, to be manageable and without hurting people a lot.
Okay. All right. I'll get you, Honorable Madenge, but first I want us to cross over to Nakuru because you're receiving news this morning that 13 people have been killed in a road accident that occurred at Ngata Bridge in Nakuru. The 13 were killed after a van rammed into a stalled truck, and police are saying that only one person survived who was in the van. And Evans Asiba is on the ground. Evans, good morning. Not so good, bearing in mind the news that you have. What more can you tell us?
Very good morning to you, Sam. As you said, it's not that good morning, but we are coming to you live from Nakuru County. It is too raining. Where we are is at Ngata Bridge, just along Nakuru-Nairobi Highway, where the accident happened at around 5:30, involving a private van that was with over 15 people. As per what the information you have right now is that at least 13 people has perished in this accident that occurred at that wee morning. What's happening right now is just the police officers are on the ground trying to to help those. So far we have told that it's only one person who has survived in this accident, and they say that maybe just the cameraman can just zoom around to show the picture of the ground, how it is like. And I'll be speaking to the OCPD Rongai Police Rongai Division, who is also here trying to help. But what happened is that this van KBB 584R was heading to Kisii. As per our preliminary details that we have right now is that they were heading to Kisii. Maybe what we have been told is that they were heading for an event in Kisii. Most likely it's either family or friends who are traveling in one direction in a private van who are heading for an event in Kisii. Reaching at here at Ngata Bridge, the accident occurred. Being told that this is the number plate of this car, KCP 599X. The car was heading to Kisii, as I said. Immediately after reaching this place where the trailer was stalled. This trailer was stalled last night. It rammed this street and killing 13 people. Maybe just if you can speak to us, tuambie tu kidogo tu kwa sekunde, tuambie nini kenye umeshuhudia katika jamii.
Sisi tumeamuka sasa hivi asubuhi tunapokuelekea kazini, lakini tulipata kwamba trailer ilikuwa inatoka sehemu ya Saliga kielekea town, kama ilikuwa na speed ya juu sana, ili kaweza kupata wenzetu walipotoka town wakielekea Kisii. Hawakuweka kutarajia kuwa watapata kitu kama hii. Tumekuwa na msangao sana, tumestuka na wengi tumekuwa tukitetemeka tukijaribu ile njia ambaye kwamba ni njia gani tuweza kuwasaidia. Ile ndio na mapolisi waliweza kukimbia haraka, tumeweza kuondoa watu, tumeweka kwa gari ili waweze kupelekwa mochari. Ndio sasa wengine pia watakuja, tutaweza kwenda kufuata, tuweze kuangalia hospitalini pale mochari ili ndio waweze kutambulika. Alafu ndio hiyo nini maendeleo. Hiyo ni msangao sana, tumeshangaa. Lakini kwa hii barabara tunaona madereva wote kwenye mkiendesha gari, tafadhali mteremko ni kali, mjaribu kusika gari zikuwe break up ili muweze kuchunga maisha ya binadamu. Kama sasa hivi tumepoteza wapendo wengi sana, tukiwa na msangao, tumeshinda chochote la kusema. Na hii ni msimu wa mvua, manake miguu hata kama iko ni mpya inaweza kuteresha.
Hebu pengine tuambie, kama umetoa watu, ni mili ngapi umetoa, watu wangapi umetoa katika gari hilo? Pengine wewe mwenyewe tu wado wenye umehesabu.
Kwa wale watu ambao tumeweza kutoa pale, watu wakubwa, watu 4 pamoja na watoto wawili. Kwa wale ni wenye nimeona, lakini si chachua vizuri namba wote, because tukiangalia hii gari sinzi vile hiko hivi ni kitu ambao unasanga utasema wameisha, lakini upata kuna mwingine katikati kwa hiyo gari.
Kuna mtu yote kweli ametoka akiwa hai?
Kuna mmoja ametolewa, but hiyo ndio ameweza kupelekwa usimu. Mtu mmoja tu I think alikuwa amekaa kwa ile kiti ya nyuma.
Hali yake ilikuwa vipi akitolewa wakati kutolewa?
Hali yake huko hali mahututi, lakini tunamuomba Mwenyezi Mungu ataweza kumsaidia.
Pengine tu tutazidi kutafuta zaidi, na pia nitakuwa nikizungumza na mwenyeji mmoja ambaye alikuwa hapa kwa muda ufao, pengine kwa mapema kidogo, tuambie alipofika nini Kenya aliona na hali ilikuwa vipi. Pengine tu kianza kwa kujitambulisha majina, tuambie ulifika hapa saa ngapi na hali ilikuwa vipi.
Kwa majina naitwa James Kemei. Ajali itokea exactly 4:30. Ajali itokea exactly 4:30 na nikaweza kufika hapa baada ya dakika kama 5. Mimi ni jirani hapa kwa barabara. So wakati tulifika hapa tuliweza kupata ajali imetokea, na tuliweza kuokoa mama mmoja ambaye amekimbishwa hospitali na alipata majeraha upande wa miguu, alikuwa amevunjika miguu, na abiria wengine wote wameweza kuaga dunia. Ndio.
Pengine tu unaweza tuambia hali iko ukifika hapa, watu wangapi, mili ngapi yenye umetoa katika gari hili wewe mwenyewe ukitoa, na ukisema kwamba ulifika pa dakika 5 kabla baada ya ajali hiyo kufanyika, ni nini hasa kilifanyika? Kama unaweza kunajua, naambiwa kwamba lori hii ilikuwa hapa, ilala hapa, hali hivi.
Yes, kuna lori ambayo ilikuwa imesimama hapa, ililala hapa, imekuwa hapa kwa kama siku 3, na kuna mmoja ambayo ilikuwa inateremka, ambayo nafikiri ile ilikuwa inateremka ndio iliweza kugonga hii gari ya abiria, na tumeweza kutoa mili 6 ya watu wazima na mili 2 ya watoto. Ndio.
Pengine mwito wako, umesema kwamba lori hii imekuwa hapa kwa siku 3. Wewe ni mwenyeji wa hapa barabara inatengenezwa pia, hiyo tutaweza kuonyesha mtazamaji. Unafikiria hii si carelessness, kwa sababu barabara hii imekuwa ndogo, ni pana, kutoka niseme tu kwamba kutoka zile more than 5 lanes zilikuwa hapa awali, sasa hivi ni kama 2. Gari limekuwa hapa limeharibika siku 3. Unafikiria serikali, tuseme kwamba maafisa wa usalama ni lipi wamelala, hawajalala kazini, hawajazembea kazini?
Kuna uzembevu wa kazini upande wa especially traffic. Wakati hii lori imekuwa hapa imekuwa stall kwa barabara, ingeweza kuondolewa, hii ajali haingetokea. Haingeweza kutokea, ni kitu ingeweza kuepukika. Lakini hii ni negligence kutoka upande wa traffic.
All right, those are the live images from Ngata Bridge in Nakuru. And as Evan Sasiba is telling us, 13 people have lost their lives. Only one person survived from that van. The face of the challenges that we face on our roads, despite the warnings that people be careful, unfortunately it's got into that. He reports that there was a stalled trailer, that that van was heading to Kisii and rammed into it. Very sad news to speak about, Honorable Madenge, at such a time that there are even warnings by Kenha on the road to Garissa after part of the bridge there also was also affected. I don't know what your thoughts are as you resume our conversation earlier on the doctor strike.
Yeah, thank you, Sam. It's a sad moment, and the statistics for the past 3 months are very, very discouraging. And I think it is time for us to revisit holistically the issue of public transport and even private transport on our roads, and the role that maybe surveillance would play, whether physical patrols or technology-led surveillance would play in terms of managing the situation on our roads. I think it is also high time that as a nation we reconsider the question of night travel for public transport. And also how to comprehensively handle vehicles that stall on our roads, especially the public highways and the inter-county highways and the international roads. It's sad that for 3 days we had a lorry that was stalled. And I think it is high time that our business people have to make a decision as to the cost of doing business. It may be necessary for us now to have a dedicated unit, either from Public Works or from NTSA, that therefore, as quickly as possible, removes any vehicle that is stalled on the road at the cost of the vehicle owner. Because then, while we may sympathize with the vehicle owner that they really may not have had anything to, what could they have done if brakes have failed when I'm on the road, or have developed a mechanical problem, but the greater risk to the rest of the public and other road users must get the due consideration it deserves.
Right.
I want to pass my condolences to the families of the people who are affected. But I think it is high time that our CS for transport initiated very, very highly and deeply consultative consultations with all stakeholders on how, for once and for all, we should deal with this menace. Our tolerance as a country to some of the problems that we are facing needs to be looked at afresh. Okay. We cannot continue losing lives in this way.
And you can imagine that in just about 12 hours or so, 19 people have lost their lives. 13 this morning, 6 last evening. And of course, the 6 people were killed last evening after a lorry and a private car collided at Duka Moja area of the Kericho-Nakuru Highway. And according to the Regional Traffic Commandant, Dorothy Muleke, the driver of the private vehicle was overtaking a fleet of vehicles and got into a head-on collision with the lorry. And obviously 6 passengers in the private vehicle died on the spot, while 1 was rushed to hospital in critical condition. I understand that the police officer that is on site in Ngata, at the Ngata Bridge in Nakuru, is reporting that the death toll is 8, not 13, as previously reported by some of the residents there. But in the meantime, Honorable Mathenge, we were talking about the strike in the health sector, that you find all services have stalled. And I remember we spoke to you, I think some 2 weeks ago or thereabout, and you're talking about this issue. And it's gotten to this point. That time, the strike was about on its 12th day, now it's on 27th day. And there appears not to be any sign of a solution coming. Has Parliament intervened, especially the Health Committee that you sit in? Is there a solution, or once the President speaks, that's it?
We have to find a solution one way or another. And even as our President has spoken, I think he has offered a solution on the table. And there are what we say are desirables. And I'll begin by saying we have the WHO standards in terms of ratios of doctors to patients. But I want to ask my colleagues in the medical profession, how many countries in the world have been able to comply with this WHO ratio for medical healthcare providers to members of the public? And more so, how many African countries have been able to comply? When we compare ourselves outside our borders, we begin to see that the health sector, literally worldwide, has been having challenges. But let me come back home. And there is a question of our Constitution 2010. And the reality is that we, as Kenyans, passed this Constitution. And we created two levels of governments, national government and county governments. And we also assigned roles and responsibilities. I come from Nyeri County, and in the last 3 days, we've held consultations across the board. All the members of parliament, the senator, the women rep, and the governor. And the question for us today is, why are the healthcare providers in Nyeri County subjecting residents of Nyeri County to the suffering that the rest of the country is going through? Yet Nyeri County government, even as my colleague, the senator, has said that we have issues with county government, Nyeri County government has implemented the CBA to the letter. But my colleagues in the medical profession are saying they are out there in solidarity. For the first time, I'm going to request them for Nyeri to at least change the allegiance of their solidarity to the residents of Nyeri County who have paid them their entire dues as per the CBA. And therefore, Nyeri County has sacrificed more than the rest of the nation. Number two, at the national referral hospitals, what are the issues? What are the issues with interns at Kenyatta National Hospital? What are the issues with interns at Moi Teaching and Referral Hospital? What are the issues with interns at Kenyatta University Hospital? Again, then why are the doctors in the national hospitals again on strike? Solidarity. So who will express solidarity with the ordinary Kenyan who requires these services? And that is why I will continue to maintain the middle stand, that we will not find solutions when both of us, government and the healthcare providers, are active combatants. Caught in the middle is the ordinary Kenyan who is left helpless, including relatives of these doctors. For us as members of parliament, we actually interact with health services on a daily basis, Sam. Let me give you an example. Yesterday, I was in an area called Thoguma. I was actually inspecting a road that had stalled since 2021, and the residents are very, very unhappy because we've not had money to pay the contractor. And now we pushed and some money is available, the contractor is supposed to move on site. As I moved to see how quickly the contractor has mobilized his people, I met one of the elderly community health promoters who informed me of one of the residents who is having TB and is not having food. I was able to call the area assistant chief, direct them to the local ACC, and luckily we had some relief food available. And before, in 2 hours' time, food had been delivered to this patient. But that is the kind of suffering. That TB patient today with complications is a death sentence. because doctors in Nyeri County are on strike in solidarity with the rest of doctors in this country.
So you're saying they have no pending issues as far as the county government of Nyeri goes?
They have no pending issues.
Okay.
Number two, in terms of remuneration, and even in terms of training, out of a complement of 137 medical officers, including dentists and pharmacists, 18 have already been released for further higher training, and 32 are online for the next financial year. These are some of the issues that are there. Every medical officer in Nyeri who was due for promotion has been promoted. And the interns who had been posted were enjoying the salaries as per this package. But this is a question, and I have insisted. The doctors have a legitimate grievances because they have a CBA that was signed by government. But the realities at this point in time is that we are experiencing challenges, financial constraints, cash flow constraints. Despite the fact that we will quickly run to State House renovations and want to say this is where our money is going. In the education sector, we have requirements for money. In the agricultural sector, we have requirements for money. In trade, my coffee farmers want more money to be pumped.
And all those are important.
And they are all important. Now, so let us come.
So
what
are the
possibilities?
And the Honorable Mudenge.
Yes.
And medical officers as important as those issues as you talk about, because you're here enumerating the challenges in the health sector and what needs to be done.
Yes.
But part of that involves the human resource.
Yes.
So why is it not a priority 7 years late?
Sam, I am actually at the Kenya Methodist University completing my Bachelor's of Science in Health Systems Management and Strengthening. Yet I'm a registrator. So I'm concerned.
Let's do this. Let's take a short break. When you come back, you'll finish the thought of what you're expressing there, because I also want to hear from the other panelists on how they have to say. But also to remind you of the accident that has occurred at a bridge in Nakuru, killing 8 people. We understand they were traveling to Kisii in one van. Only one person in that vehicle survived. And as soon as we get more details, we'll be bringing them to you. But at this point in time, we've seen the mangled van that was just about to be pulled away to be taken to the police station. And that's the sad news of the morning. We take a break. When we come back, we have more. We conclude on the question of the health issue, but also reflect on what just happened in the fertilizer issue, with the president confirming that indeed there's a problem. He wants people arrested, but the cabinet secretary is insisting that the only issue is with some 3,000 bags. After the break, we talk about that.